Hey, this video goes out to somebody who goes on the handle Dea Mix. Alright, Dea, you're talking about having elbow pain, Meloxicam, and Prednisone, and some comments that I might have made in other videos about the combination. So let me tell you a few facts. Meloxicam is a COX-2 inhibitor. A COX-2 inhibitor is a type of NSAID, or a non-steroidal anti-inflammatory drug, and under the category of NSAIDs includes aspirin, Motrin or ibuprofen, naproxen or Aleve or naproxen sodium, diclofenac, which goes under the names of Voltaren, Voltaren XR. There's others. There's ketoprofen. There's indomethacin, there's Clinaril, there's Lodine, there's Relafin. There are so many. I can't understand for the life of me why on earth the FDA allows $1 billion to be spent on drugs like that. By the way, Celebrex is on the list. Vioxx and Bextra were on the list. They were taken off the market. By the way, I'm in the mobile office. Don't ever forget, I am in the mobile office. And sometimes with the mobile office, I gotta actually watch the road. So, you don't want to hear a crash out of the mobile office. That would be not good. So I'm gonna veer off. This is really terrible. People talk about, why don't we have a cure for brain cancer, pancreatic cancer? Why can't we do anything for people with, rare diseases such as vasculitis or lupus with kidney failure? Why don't we have better treatments? Well, for holy hell, every new drug that comes to market is a $1 billion, and most of those drugs have already been out, for 1 million years under another name, and they're called Me Too's. Everyone gets the patent extended and gets to cash in off the public. So it seems like the government is getting a little frustrated with this, but, without somebody like me advising them, I don't think they know what to do. I mean, it appears to me that nobody up there in healthcare really seems to know what to do or whatever when it comes to the pharmaceutical aspect of it anyway. And then there's people, of course, that don't understand that the hepatitis C drug for $80,000 is a bargain, because if it keeps you out of the hospital one time, you saved $800,000 of ICU time. Anyway, let's get back to your question. Meloxicam is an NSAID. So, Prednisone is a steroid. Prednisone does not cause peptic ulcer disease. Meloxicam or other NSAIDs do give an increased risk of peptic ulcer disease. When I say peptic ulcers, I'm talking about the stomach, but mostly I'm talking about the small bowel. So aspirin burns a hole directly through your stomach, okay? Now, drugs like Meloxicam, which is a COX-2 inhibitor, is supposed to block prostaglandin less, therefore lowering the risk of giving you an ulcer. However, ibuprofen and naproxen and all the other ones you're familiar with, Lodine, Relafin, Clinaril, whichever one you like or don't like, or indomethacin, they all work because they block prostaglandin. Well, without prostaglandin, you're going to get ulcers in your small intestine. And when you add prednisone to an NSAID product, even though the steroid does not cause ulcers, the combination of steroids and NSAIDs gives you a higher risk of ulcer than NSAID use alone. That is a fact. There is no ifs, ands, buts, or maybes. Now, you mentioned about taking one of them or both of them, and I honestly have to admit I don't remember the details. You were taking it for elbow pain. The most common causes of elbow pain that I do see in my practice, I would say the most common could be olecranon bursitis, in which case you typically drain and or inject the bursa. I see a lot of lateral epicondylitis, which is called tennis elbow. I inject the tendon sheath, and contrary to the literature, my success rate is much higher than they report. The same goes for medial epicondylitis. The same goes for cubital tunnel syndrome, which is like carpal tunnel syndrome, except it's on the inner aspect of the elbow. That's from an entrapment of the ulnar, ULNAR, as opposed to ulna, I think. I'm a little tired. Anyway, the other elbow problems would be in the front where you have blood drawn. Usually if you have pain there, it's coming from another source. And then you can have arthritis, rheumatoid arthritis, gout, psoriatic arthritis, whatever you like, can affect the elbow. And then again, you inject the joint typically if that's the only joint involved. If many joints are involved, then that theory doesn't work. So I really hope that this answered your question about the combination of them. They are used simultaneously, but in today's day and age, there's almost no role for NSAIDs in chronic arthritis. It's good short term, for a headache or a sprained ankle, but that's about it. So many billions of dollars spent, and steroids are very cheap, and steroids, for the most part, if you took a global comparison, I personally think low-dose steroids are safer than any continuous use of NSAID products. Okay, the sun is setting, and I actually am heading back to the office. I want to see what's going on. I want to make sure the bushes and groundskeeping is all pretty, because we have such nice patients. Everybody should feel at home, so we want our lawn to look like you would want your lawn to look like. And with that, I'm signing off from the mobile office. This is Dr. Soloway reporting to you live from my car.